There is no definitive treatment that favors the production of a larger amount of semen. However, healthy habits like a good diet, varied and rich in vegetables and fruits, staying well hydrated, and avoiding tobacco and alcohol can help increase the amount of ejaculate, in mild cases where lifestyle may be affecting seminal volume. If the lack of seminal volume is caused by a condition in the seminal vesicle or the prostate, the urologist will indicate the most appropriate treatment according to the condition. If the semen analysis diagnoses another seminal problem besides hypospermia, such as low concentration, oligospermia, poor motility, acetospermia, or morphological alterations, teratospermia, in the sperm, the probability of achieving pregnancy naturally will be further reduced. Therefore, if the couple has been trying to get pregnant for more than 12 months, or 6 months if the woman is over 35 or 38 years old, it would be advisable to resort to assisted reproduction techniques such as artificial insemination or in vitro fertilization, IVF.